Today our group is presenting our reflections on an analysis of an organisation. The organisation we visited was Albury Wodonga Health in the social work department. Our interview was specifically about social workers' role within the hospital and also a focus on Nolan House, the mental health inpatient unit. We met with Jason McMartin, the AWH Social Work Discipline Manager, to interview him. I, Bron, will be talking about Jason's specific role as AWH Discipline Manager. I'll give an overview of AWH and Nolan House and discuss AWH mission statement. Michaela will be talking about governance, funding and structure of the organisation and the services provided. Rachel will be talking about advocacy, to be an employee, to be a patient. And finally, some recommendations, suggestions will be provided. Firstly, I'll be discussing the main responsibilities of Jason's role as discipline manager. Jason's role includes providing supervision, both informal daily and formal monthly, planning work allocation, organising roster, staffing and leave, representing AWH and interdisciplinary meetings, internal clinical meetings and our own team meetings, problem solving with other managers around complex cases, managing complaints, clinical caseload, running interviews and filling job vacancies, facilitating student placements, sourcing and running professional development, keeping everyone happy. During our interview with Jason, we gained an insight of the workings and realities of the conditions in which the social workers work within the hospital, particularly around lack of funding and also lack of beds to accommodate the high volume of patients requiring admission into Nolan House. When discussing the mission of the organisation, Jason stated that missions can be seen as tokenistic and corporate. He said that when looking at the mission statement, you need to ask yourself, how relevant is the mission statement to the organisation's goals? Jason stated that from a social worker's perspective, we go by the core social work values that align with the AASW Code of Ethics. The social work team operates specifically within the framework of the core social work values and ethics. Jason went on to discuss AWH purpose, vision and values. Our purpose is to deliver safe, reliable, responsive patient care. Our vision, Albury Wodonga Health, the best of health. Our values, ethical, teamwork, respect, trust, accountability, compassion, equity, patient and client focus. Jason mentioned that most of the values do relate to the role of social workers within the hospital, but they have the freedom to work within the values, ethics and guidelines of specific social work practice. Now I'll give a brief overview of the organisation as well as the history of Nolan House. Established on the 1st of July 2009, it is the first cross-border public health service to exist in Australia. Operates under an agreement between New South Wales and Victorian governments to provide the largest regional healthcare services between Sydney and Melbourne. We have over 1,700 staff and over 200 volunteers meeting the needs of our diverse regional community. 2 public hospitals, Albury Hospital and Wodonga Hospital. 2 community rehabilitation centres located at the Albury and Wodonga Hospitals. Wodonga Dental Clinic, Mental Health Service in Wodonga, Beechworth and Wangaratta. Child and Adolescent Mental Health Services located in Wodonga and Wangaratta. Social workers play a crucial role within AWH. Social workers provide social support for people requiring assistance in the areas of, but not limited to, advocacy, accommodation, finance, adjustment loss, and relationship issues. Nolan House is located on the grounds of Albury Base Hospital, Since the deinstitutionalisation of acute mental health services and the closure of Mayday Hills in Beechworth in 1995, Nolan House was established at Albury Base Hospital because of the closure, which welcomed a move away from the asylum model to the community services model. Thank you.
On August 4th, we were shocked to read in the Border Mail that Nolan House was forced to close their high dependency unit due to lack of funding for refurbishment. They stated they required $20 million for this refurbishment and they were only offered $1 million. When this topic was discussed with Jason, he mentioned that this is not actually an uncommon occurrence and the publicity of this closure was welcomed as it brought awareness to the underfunding of mental health in the public light. When asked who would be responsible for advocating for the reopening of the high dependency unit, we were notified that the responsibility lay in the hands of the consumer advocacy group. Staff at Nolan House, although disappointed by these closures, are tightly bound by professional protocols. All contact with the media must firstly be given permission from the media department. Other than the closures, students were given the perception that staff at Nolan House were happy to be there. The nurses opt to work on this ward instead of the other wards within the hospital. To be a social worker at Nolan House would be an opportunity to work within a different environment and with different people who present with a wide range of mental illnesses every day. Whilst having this opportunity to become familiar with multiple illnesses, Nolan House would also offer a position to work within a team of health professionals. The inpatient mental health services of Nolan House are available for people aged 18 and over, requiring a hospital stay due to experiencing acute mental distress. Patients come to be admitted to Nolan House through a number of different avenues. Through the emergency department, court-ordered, doctor-referred or community health services. Under New South Wales law, patients can be admitted without their consent if it is thought that they are a danger to themselves or the community. These patients must be assessed and admitted to the ward by psychiatrists. New South Wales are also permitted to have locked wards where patients' movements around the facility are closely controlled and sometimes restricted. Involuntary admittance and locked wards would sometimes cause ethical dilemma for some, but we were informed that the suicide rates of patients in Victoria are higher than those of New South Wales, and these two factors may play a part in that. Due to the high dependency unit closure, patients are being turned away to other facilities such as Wagga, Wangaratta and Shepparton. This was identified as being a risk factor as many patients fall into the low income bracket and are not able to have family and loved ones support close to them. Inpatient care is provided on a short-term basis. The average stay is 3 to 5 days, during which they will be cared for by registered and enrolled nurses, assessed by psychiatrists and social workers, who have the patient's best interest in mind. Nolan House staff work with patients' families and loved ones and carers to ensure that consistency and support is reiterated. There is a strong emphasis on patient-focused recovery. During the administration, patients may be prescribed medication in order to aid in their recovery or assist in management of their illnesses. After discharge, the Nolan House staff work with community health to ensure a smooth re-entry into the community, with community health workers visiting within the first 5 days of discharge. Due to security reasons, safety and confidentiality, students were not granted access into Nolan House, instead meeting in the Allied Health Building of the Albury Wodonga Health. However, we were provided with an open stage for discussion of the running of Nolan House, and Jason gave off a very caring and patient-focused impression. He seemed very genuine and made it clear that the staff of Nolan House have a passion to be there, aiding their patients, even making the comment that the staff of Nolan House never want to leave and often stay until they retire.
Mental health is extremely underfunded and there are large funding gaps. When talking to Jason, he confirmed that if the mental health sector has a win in funding, it does not always necessarily go solely to them. It is shared around where it is needed in the health department. The average cost of a week's stay in Nolan House is $14,000, which is equal to a week in a private facility. Nolan House have the capacity for acute mental illness, however private facilities do not have the capacity to take anyone over depression or anxiety, as the majority of the private facilities cannot medicate. Nolan House is funded by the New South Wales state government, but is run by Victoria. It is one of the only organisations in Australia that is funded by one state and governed by another. As previously stated, the governance puts importance on following their policies and ethics and incorporating policies appropriate to social work within their organisation. The board for Nolan House is New South Wales Government, and the board of directors are appointed to oversee the management of Albury-Wodonga Health as a public health service under the Health Services Act 1988. The board of Albury-Wodonga Health is accountable to the Minister of Health for conduct, performance and culture of the organisation. The board is made up of 9 people who are appointed upon the recommendation of the Minister of Health. The Albury-Wodonga Health website states that the team of staff at Nolan House is multidisciplinary, made up of nurses, occupational therapists, social workers, a consultation psychiatrist, consumer and carer consult. In the interview with the social worker, he stated that there were 4 rotating psychiatrists, social workers, registered and enrolled nurses, and administration staff. The staff work in close collaboration with community caseworkers, support networks and other healthcare providers to maintain links with the patient's community supports, making a discharge a smoother process. It is important that a discussion is had with the patient regarding the involvement of the patient's support team and loved ones in their stay in Nolan House. Having familiar faces and people the patient trusts involved in their stay can be highly beneficial and can influence how well they engage in the services and what they gain from their time in the inpatient unit. Nolan House provide a number of services ranging from inpatient mental health care and assessment to collaboration with community health, which is sometimes before a patient is admitted and always after a patient is discharged. Due to the range of mental illness the patients present to Nolan House with, the use of medications is often required. Unlike other mental health facilities, and due to the medical hospital environment in which Nolan House is situated, staff have the ability to administer prescribed medications as there is a psychiatrist present. This is sometimes in the form of sedation if a patient presents aggressive or agitated. As well as ill mental health, Nolan House also assists in the treatment of recreational and prescription drug abusers and drug detox. As a group, we discussed how Nolan House could be improved. The obvious answer was an increase in funding for refurbishments and a possible extension, as 14 beds serviced in the Albury-Wodonga and surrounding areas do not seem adequate. With the introduction of extra beds, we also feel the addition of another social worker would be appropriate given the increased workload.